Good morning, Palm Beach County Justice Association and friends. My name is Joshua Horton with Romano Law Group. I'm going to be talking to you a little bit today about our substance use disorder litigation that we've recently enacted a litigation group with the American Association for Justice with, along with some of the opiate litigation we're doing in the MDL in Ohio. I myself am a formerly incarcerated individual, and I have firsthand experience with substance use disorder, and I literally learned these systems from the inside out. So I do this, not just as a job, but as a passion. And what I'm going to do today is I'm going to kind of give you the 30,000 foot view to begin with. Then I'm going to zoom in and do an up close work on what we're doing here on the ground in Palm Beach. And then I'm going to back up to another 30,000 foot view and kind of show you the overarching theme, even on an international level. So, first, how did we get here? And the answer to that question is we started with the drug war back in the 1970s, the Nixon administration, and we started criminalizing substance use disorder, which has been probably the largest failure in the criminal justice system history of this country. We now lock up more people than Russia and China combined per capita. We have the largest incarceration rates in the world, with 60 to 80% of the people behind bars suffering from substance use disorder. I'm just going to read some stats that I got before this to give you an idea of the numbers. Of the 2.3 million people in American prisons and jails, more than 65% meet the criteria for addiction. Drug overdose deaths have more than tripled since 1990. From 1999 to 2017, more than 700,000 Americans died from overdosing on a drug. That's more than the entire Vietnam War. In 2017, 20 million Americans have SUD. 8.5 million American adults suffered from both a mental health disorder and a substance use disorder or co-occurring disorder, but only 10% of these individuals receive treatment. What's happened is we've criminalized a medical disorder, thereby stigmatizing it, where people are afraid to go seek treatment. We don't provide treatment. We've got a system of cages instead of a system of care, and we're dealing with this on the back end. It's kind of like they say a penny of prevention is worth a pound of cure. We've done no prevention and we have no cure. So we've got one of the largest killers in America. It's the number one cause of death for people under 50 now, is substance use disorder. Like I said, it's labeled a disease by the DSM-5, by the American Psychiatric Association, yet we're still incarcerating people for it. There may be, issues with that, with the ADA, that we're starting to investigate. So where are we now? What this has done is this has led to the Wild West of law and policy on the back end, because there's virtually no regulation for what's been going on in the substance use treatment industry. And Palm Beach County in particular, and why I came here, is because this was, ground zero for patient zero, which was the pill mills that started here and fueled a lot of the opiate epidemic. And now what we're seeing is that we're calling it patient one, which is now from the patient brokering and the lack of regulation with the substance use disorder treatment industry. And just to kind of explain how this works with the legislature, even though doctors and treatment providers work together, the Administration of Healthcare does not regulate treatment centers. It's regulated by the Department of Children and Family Services, which has been kind of confusing as we've been litigating some of these cases, because they're asking that we pre-suit these defendants, but we're not required to pre-suit anyone but the doctors, because these individuals are not licensed by the Administration of Healthcare. They're not mentioned in the medical malpractice statutes, and they are able to be sued under regular negligence just like anybody else. Sober homes have virtually no regulation whatsoever, except for what has been delegated very recently to FAR, the Florida Association of Recovery Residences, and those are still really, really thin. There is no degree required for opening a treatment center. If I'm an optometrist, or if I want to open an optometry clinic, I better have a medical degree or something. I don't even have to have a high school diploma to open up a treatment center. And that's what led to individuals like Kenny Chapman and others who occupied this gap, which has led to, a space for predatory behavior to step in. There was millions in healthcare fraud. I'm sure most of you are aware of the cases with Kenny and others. Doctors essentially prostitute their licenses out to sometimes dozens of treatment centers. And there's just no way that a doctor can be providing appropriate levels of care to 20 different treatment centers at once. It's impossible for him or her to see that many patients. And essentially what you've got is dentists doing heart surgery. You've got people that are, OBGYNs doing addiction treatment, and they've never received any they might have done an 8-hour weekend course for some CMEs, but that's it. They're not specialized in addiction treatment. They're not specialized in mental health. They're, cashing in on what's, available to them right now. And now what we're also starting to see is with MAT, if you are providing treatment in Florida and you receive any kind of federal funding, whether it be Medicare or grant money, whatever, you're required to provide medical assisted treatment. It's a lot like methadone in the sense that they're just handing these people medication without doing the requisite, behavioral health counseling or therapy that needs to accompany that medical assisted treatment. So essentially it just becomes drug replacement therapy, which is not what we want in the treatment industry. Many of these individuals with the treatment centers also own their own labs. They own their own sober homes. They've set up this cycle where they're cashing in at every corner on the backs of substance use disorder. That's just created the perfect storm for fraud and joint venture, essentially. Poor treatment leads to the wrongful death of many patients that are not receiving appropriate levels of care despite severe diagnoses from their own psychiatrists and doctors on staff. They're coming back into the treatment centers at an outpatient level because it's an easier licensure obtainment for the center. And it's clear, even in the medical charts, that these patients are not at the level of outpatient care. They definitely require of some sort of a more structured level of care. And like I said, this leads to the wrongful death of many individuals. The fraud with the labs is for overbilling, overtesting. They've called it urine farming, where they're essentially milking the patient for their urine, charging thousands of dollars per urine test when you can buy one at CVS for $15. You got poorly trained individuals running therapeutic settings. The interns that they hire for little or no money are not properly supervised in the treatment centers. And what happens, and this has actually led us to some of our other claims, which involve sexual assault as a result of the inadequate supervision of the patients. I mean, we all know about the inappropriate boundaries with therapists and their clients sometimes. It's the same thing with substance use disorder treatment, and sexual assault, human trafficking is rampant in this industry. The predatory behavior that I'm talking about leads me into one of my next issues with this. Is what we've been looking at is the chapter 415.1111 statute, which is usually used in an elderly abuse situation or a nursing home. But after looking at it and reading over it, I think it certainly can apply to some of these individuals needing service for substance use disorders or treatment. The chapter says, a vulnerable adult who has been abused, neglected, or exploited as specified in this chapter has a cause of action against any perpetrator and may recover actual and punitive damages for such abuse, neglect, or exploitation. Then I just kind of want to tell you what the definition of a vulnerable adult is. A vulnerable adult means a person age 18 or older whose ability to perform the normal activities of daily living and or to provide for his or her own care or protection is impaired due to a mental, emotional, sensory, long-term physical or developmental disability or dysfunction or brain damage or due to the infirmities of aging. I think the mental and emotional disorders that these clients are diagnosed with clearly falls within the statutory definition of what they intended to protect with Chapter 415.1111. Also, just referencing a sister statute under Department of Children and Family Services, which actually regulates the substance abuse services, it actually states that the legislature recognizes that consumers of substance abuse treatment have disabling conditions and that such consumers and their families are vulnerable and at risk of being easily victimized, and to protect the health, safety, and welfare of this vulnerable population. So the legislature itself even speaks to the vulnerability and the disability of those with substance use disorder. Another issue that we see that needs to be remedied both at the legislative level and in the courtroom is the use of ER treatment when somebody overdoses. If I slip my wrist and I go into an emergency room, they are going to Baker Act me and hold me for 3 days, no questions asked. But if somebody commits suicide by injecting a lethal dose of fentanyl, they go to the emergency room, they are literally resuscitated from death and put back on the street within hours. I think this is a gross deviation from a standard of care at the emergency room level. And also, I think the Baker Act needs to be amended to cover these overdose essential suicides where the victim not only comes out after being Narcaned in the emergency room, is back on the street within 2 to 3 hours in a worse off state than when they went in, because they're now without the drug and they've been resuscitated with zero ability for treatment. Like I said, it covers the medical malpractice of the doctors as well. What we've been doing in some of our cases is we're running two simultaneous cases. We've got a medical malpractice case against the doctors and other medical providers as defined under the statute, and then we've got the parallel case running for negligence and other counts ranging from 415 violations to fraud to joint venture, all the other kind of stuff that we're finding. And what we end up doing is we bring those cases together at the end of pre-suit. The effects of this, I'm now going to kind of back up to the 30,000 foot view and just kind of explain, how many different areas of law this really touches. So I already kind of discussed the criminal aspect and locking people up for a medical disorder and the possible ADA violations associated with that. How can we be, telling somebody that they've got a disease on one hand and then putting them behind bars for the same, disease just because they're poor? And, if you're poor, you go to prison. If you got money and resources, you go to treatment. That's just kind of the way it is. And I think there's certainly some violations there and some opportunities for policy reform. You got the mass tort issue with the opiates and what's now the fentanyl epidemic. So, the opiates were bad enough, but now what we're seeing is the fentanyl coming in. And here at Romano Law Group, Susan Ramsey has headed up our opioid litigation here with the MDL out of Ohio. We're representing dozens of municipalities and counties throughout the state of Florida, as well as others. And we're trying to do that at the municipality level. Things are looking, better or worse depending on what day we're talking about it up in Ohio. The already discussed the negligence, the med mal, the fraud, the wrongful death, the joint venture, the sexual assaults that happen as a result of this. But even on a bigger level than that, on a global level, what we're really starting to look at is international law violations. Because let me explain it to you this way. If I'm China or I'm Mexico and I want to kill an entire generation of Americans, I don't need to send thousands of troops to the shore. All they're doing is boxing up synthetic opiates that are exponentially stronger than any opioid that's ever been manufactured by a pharmaceutical company, shipping it directly to Americans, and we're killing ourselves. So, now I think I was talking to someone the other day, and people can actually go online, give their own chemical construction to some lab in China, and they're literally boxing up whatever you design on the internet and shipping it to your house. And I would argue that this is nothing more than international terrorism on a big level, and we're starting to discuss that with the American Association for Justice as well, on how we can hold foreign entities accountable, just like we would hold the Taliban accountable for the attacks on the USS Cole or other different attacks on Americans, both domestic and abroad. These are just some of the issues that we're touching on here with the substance use disorder litigation group. The more we kind of drill down into it, the more we're finding the gaps and the opportunities for litigation as we go forward. And like I said, because of the lack of resources, the stigma, and everything else, this is a really new area of law that we're looking to launch out of Palm Beach County. And when I was out in San Diego a couple of months ago, what we saw was, and who we've kind of partnered with in San Diego at the Gomez Law Firm, what you've seen is because of the patient brokering laws and some of the other laws that have gone in effect here in Palm Beach County and Florida in general, it's kind of like turning the light switch on and the cockroaches spread. So now you're starting to see these treatment centers, the same individuals, open up shop in Malibu, in Las Vegas, in Arizona, a lot of the other destination states around the country, because they know that the loopholes exist out there. They know there's nobody holding them accountable, and it really just gives us an opportunity as civil litigators to step in and protect vulnerable individuals from predators who are putting profit ahead of patient care, and results in the death of thousands and thousands of Americans every year. If you have any further questions about this, or you'd like to get in touch with me regarding this, I'm happy to help. My email is Josh, Josh, at RomanoLawGroup.com. I appreciate you tuning in, and I look forward to talking to you.